Temporary Speaker.
Thank you, Minister. I call the member for Balmain.
Thank you very much, Mr Temporary Speaker. I rise today to address an issue of great importance and urgency, an issue which strikes at the heart of our commitment as policymakers. On the 30th of June 2013, a crucial life-saving service will be discontinued because governments in this country cannot be shaken into action. I'm speaking of the Custody Notification Service, the CNS, a 24-hour legal advice and Are You OK phone line for Aboriginal people taken into police custody, operated by the Aboriginal Legal Service. It is a vital service which will end in a matter of weeks unless funding is urgently found. And I note the Attorney General is here, and I welcome the fact that he's here for this discussion. In June 2012, the New South Wales Government informed the Aboriginal Legal Service they will not fund the 24-hour phone line, despite the Aboriginal person's access to legal advice by the ALS being written into New South Wales legislation. Under New South Wales law, the police must contact the ALS every time an Aboriginal person is detained in a New South Wales police station. The Aboriginal person is given the opportunity to talk to a qualified ALS lawyer and is advised on his or her rights in custody as well as his or her legal situation. The lawyer can talk to police on behalf of the detained person, can contact family and friends and ascertain if the deemed person is okay. The CNS came out of a recommendation from the Royal Commission into the Aboriginal deaths in custody to ensure the rights and welfare of Aboriginal people while they are in custody. The CNS operates in New South Wales and the ACT, taking an average of 300 calls per week and providing over 15,000 instances of legal advice and health and welfare checks to vulnerable Aboriginal men, women and children every year. Phil Naden, the CEO of the Aboriginal Legal Services, said, quote, "Threats of self-harm are common and suicide are common," end quote. The ALS lawyers are skilled at assessing and acting on these threats of self-harm and suicide and where appropriate notify the police, ensuring the safety of the person in custody. One CNS lawyer has said that at least once a week someone threatens suicide. With Aboriginal rates of incarceration already deplorably high, we simply cannot afford to let this service cease. Mr Naden has also noted that, quote, "Without the phone line, it is very likely Aboriginal overrepresentation will increase," end quote. 2 decades after the landmark Royal Commission into Aboriginal deaths in custody, most of the 339 recommendations of reform have not been implemented. And a recent major review of deaths in custody has found a spike in the number of Indigenous deaths in Australia, in line with almost a doubling of the number of Aboriginal people being locked up. That's the Australian Institute of Criminology report. Since the CNS began operating in the year 2000, I'm proud to say, and I'm sure we all agree, there has not been one single death in custody. This service is a rare example of a positive and effective reform that came out of the Royal Commission. In order for the CMS to continue this crucial lifeline, it needs an annual funding commitment of only $500,000 for 3 to 5 years, starting in the 1st of July 2013. This basic and invaluable service, a lifeline, costs the same as it would annually to hold a few young people in detention for 1 year. When this government can find $300 million in tax breaks for the poker machine industry, it finds $19 million to allow hunting in national parks. It chooses to support big developers by the way of tax gifts, incentives and exemptions, but we can't find $500,000 for this service.
For abolishing it?
Well, I take the interjection from the Minister. I do condemn them for abolishing it, but I understand their argument that it's written into New South Wales legislation and it's a requirement of the legislation that New South Wales Government provide this service, which came out of the Deaths in Custody report. My argument here today is that there is a disagreement over funding, which I agree. Considering it is written as a requirement for the New South Wales Government to undertake this in their own legislation, I would hope that the New South Wales Government can work with the Federal Government or alternatively seek to fund it. Because the system that we have at the moment will mean that there will be no funding for this service. It's important to recognise that when we think of the injustices in our legal system visited upon Aboriginal people over many generations, when we think of the stolen generation, an unforgivable and continuing gap in health, education and social outcomes of our Indigenous population, the disproportionate rates of incarceration, we need to resolve this issue and have funding support. I implore the Premier O'Farrell and the Attorney General, who I note is here, to recognise the requirement of this service as it was legislated under a New South Wales Act. Of course I'm concerned that the Federal Government has ceased funding, but I think on an objective analysis, considering that it is part of New South Wales legislation, it is fair to say that the state government should at least make a significant contribution to this. We cannot allow this to fail. I'd like to particularly recognise the 187 staff of the ALS who stepped up when the governments failed to do so, and they took a pay cut, Mr Temporary Speaker, in order for the service to continue. These dedicated administrative, field and legal staff and this inspirational decision is especially noteworthy given that ALS staff wages are already substantially lower than those in comparable legal organisations. I call on the Attorney General and the Premier to address this issue with some urgency. Thank you, Mr Temporary Speaker.
I thank the member for Balmain.